Hi, and good morning. Welcome to Envision New Mexico. Welcome to our first 2016 of Fall Adolescent Health Initiative. And thanks again for joining us on our new platform, Zoom. Hope you didn't have too much trouble with that. Should be a little bit more self-explanatory, we're hoping. And we do have a number of you on camera, so thank you very much for doing that. And so today we'll be doing roll call through a chat box. If you're unable to use the chat box or you can't find it, it's down there at the bottom of your screen. You do have to click on it in order to enable it. If you're unable to do that, you're definitely welcome to unmute and let us know that you're out there in just a few minutes. But we do have a few items to cover. So you can see a few guidelines that we wanted to let you know about, that as soon as you come on and you're made a panelist, and you're going to be live. So we're going to see you on camera and we're going to hear you. So make sure that your camera's adjusted and make sure you mute if you need to have a conversation, patient comes in, something like that. So we're going to begin in just a EU certificates today, or for our certificate program, you do need to let us know that you're out there, and we'll have an opportunity for roll call in a moment, but feel free to chat in at any time. Your computer video, we'd love to see you, and thank you very much for those of you who are on. If you have muted your camera, which is one way to put it, or stopped your video, then you can unmute that or unstop it, which would be starting it, down at the bottom left of your screen. And same spot right next to that to the left, or unmute. Leaving it muted for the majority would be a good idea, and unmuting for when you have a question or towards the end when we have discussion would be fantastic. Our disclosure and accreditation statements are on screen right now. Those are required for CME and CEU certificates. And we wanted to talk just a minute about this. Molina Healthcare and Blue Cross Blue Shield Centennial Care, so our Medicaid patient or partners, have partnered with Envision New Mexico, and we do have case consultations available, particularly for our AHI series. We do have 2 sessions specifically set up for that, and we'll go over that a little bit more later this morning. But those are part of our Adolescent Health Initiative certificate program. So definitely pay attention to this slide. These slides are available on our website on the calendar, by the way. So we do have reimbursement available from Molina and Blue Cross Blue Shield if you bring your actual cases to us. So there's a form to fill out. You don't have to provide all of the information, so don't let that get in the way. But send it in to us. We'll have our experts take a look at it and give you some recommendations along with some discussion, and we provide those in writing. And then you can bill Molina and Blue Cross if they cover your patients. Molina offers up to about 150, Blue Cross is around 75, and that's per time that you submit. So take advantage of this. This is an underutilized program. And let's definitely start billing these entities. And contact myself or Michelle Widener for more information. There's also a Molina and Blue Cross resource here for more information if you have a specific question for them. And now's your opportunity for roll call. We do have a number of people chatting in. Thank you all. And if you're not able to use that chat and the only way you can do it is through audio, then please go ahead and say your name now. Give you just a second. And I'll go ahead and hand it off to Caitlin Adams, our Adolescent Health Initiative facilitator from last year.
Great, thank you, Kevin. So also to know, if you're in a group or at any time, if you're attending one of these sessions in a group and you're chatting in the chat box for attendance, please make sure you list all people who are in your group, as we need to make sure that we count all people who are present so that you all can get credit. So Kevin, if you could roll the slide, thanks. So we're going to just go over a little bit about the adolescent health certificate requirements since this is the first session of the series. Many of you are enrolled as a certificate participant, so we just wanted to outline the information here around the requirements. If you're not enrolled in the program, we certainly invite you to consider joining, and you may decide that at a later time. You're also welcome to join us for any of the sessions, even if you're not enrolled in a certificate program. So please spread the word. There's still time to enroll, even if you know somebody that wants to join later, we can accommodate folks to join the certificate program for at least another few weeks. So please get the word out, and also consider joining if you are enrolled. So we have the detailed information listed here, and as Kevin mentioned, if you are enrolled as a certificate program, you do need to present a case for consultation during one of our case consultation forums. And I want to let you know that we have canceled the September 28th date that we had arranged for that. So we didn't have anyone signed up for that, but we do still have two options for presenting. And because this is a cohort of folks who are learning together about adolescent health, we really encourage you to please join by video each time. We really like to see your face and know that you're out there, and have a better opportunity to interact. So as you're coming on, please make sure that you're joining us by video. And another piece that I would like to highlight about the requirements is that the pre-participation survey. Yesterday, we sent a link to all of our current enrolled certificate participants, and you do need to complete that pre-survey. It's fairly brief, so please do so and submit that back to us. It is de-identified, but we can at least know if you've completed it by the link, if you've clicked on the link and completed it. So please make sure you're doing that as part of your certificate requirements. And at the end of the each 12-week series, there will be a post-participation survey. Additionally, one thing that's new for all participants, regardless of whether or not you're enrolled in the certificate program, we are now having you complete a quick survey at the very end of each session so that we can have some immediate feedback about any technical difficulties, just about making sure that you felt objectives were met, and any kind of feedback you have about the session. So that's for anyone who's participating, and Kevin will provide that link at the very end of our session. And Kevin, if you could turn the slide for me, please. Thanks. And so this is the Adolescent Health Initiative of topics, so that way you can see what's coming up. As a reminder, please make sure that you go to the Envision New Mexico calendar and register for each course. We do not automatically enroll you, so you do need to go to the website and click on the session to enroll yourself in each of the courses. And so here's the lineup for the next several weeks, and we are excited to bring some new presenters and new topics as compared to last year. And so we'll also be getting the following months up on the calendar as in the coming weeks. So you can just keep looking for those on the calendar on every Wednesday morning. So at this time, I'd like to turn it over to our new facilitator, Jeannie Dalen. So as you may have known, I was the facilitator of the Adolescent Health Initiative last year, and this year it will be Jeannie Dalen. And she is a clinical psychologist and research assistant professor in the UNM Department of Pediatrics, and a research scientist at the Oregon Research Institute and Center for Family and Adolescent Research. And she is also the lead content expert and trainer for motivational interviewing here at Envision New Mexico. So we've worked with Jeannie for many years, and we're excited that she can, she'll be the facilitator for the upcoming initiative. So you'll be seeing her each week, and she'll also be involved in the case consultation forums as a consultant and as a facilitator. So I'll turn it over to you, and welcome. Thank you, Jeannie.
Thank you, Caitlin, and good morning, everyone. It's great to be here, and I am thrilled to be a part of the Adolescent Health Initiative this year. We put together here at Envision, there's some great relevant and usable topics in adolescent health, so I think everyone's going to be really, really thrilled about this program this year. Again, as Caitlin mentioned, I am used to doing motivational interviewing. I'm a clinical psychologist, and so my job as moderator is not only to just get us started each Wednesday morning, but also to really help you guys through the Adolescent Health Initiative through this semester. So I'm here for case consultations to help you maybe craft your case consultation, to sprinkle my words of advice with motivational interviewing throughout all our presentations, and to really help guide. And I'll echo what what Caitlin said, seeing you guys on camera is a wonderful thing. It really does allow for a more richer interaction. So I love for you guys to be on camera, and those of you who maybe are not actually on video, yeah, absolutely, it's wonderful. I really encourage you guys. Slippers, curlers, it's okay. Just go ahead and come on, and we're all in this together. So with that being said, we have a wonderful presentation this morning from two wonderful presenters. Our first is our very own Jane McGrath, who Dr. McGrath is the Chief of Adolescent Medicine here at UNM and a provider in the School-Based Health Clinic. And then to my right, we have Melanie Baca. Dr. Baca completed her family medicine residency at UNM, and she's currently completing an adolescent medicine fellowship at UNM as well in the Department of Family and Community Medicine. And she works as a provider at the UNM Atrisco for Family and Community Health, which is a clinic located on the Atrisco High School campus. So with that, I'm going to turn it over to them and we'll get started this morning.
Can we have the next slide? I'll just introduce myself. Hi, I'm Jane McGrath, for those of you who don't know me, and I see a number of old friends and maybe some new people. I'm wondering if Kathleen Powers is maybe sent to us from our dear friend McCain Scharf. I'm not sure, but I'm just thinking that that might be a connection. Anyway, good morning and great to see all of you here this year as we continue in our series on adolescent health. One thing that didn't get mentioned that I'd like to bring up is that this first series, this fall semester, we're kind of seeing as some basics in adolescent health, both very common medical conditions as well as some of the other things that we always need to take into account when working with adolescents, such as the legal framework for confidential services and those kinds of things. Next semester, we plan to have a very serious focus on behavioral health and substance abuse. So if those are issues of great interest to you, think about joining us again for our second semester. So with that, I'm going to hand the microphone, sort of, to Melanie to get us started.
Good morning, everyone. I'm Melanie Baca. I recently completed my adolescent fellowship, and I'm really excited to be sharing some of what I've learned in the past year. I'm going to start out talking about elements that make a clinic adolescent friendly. So if we want teens to come in for care, we need to make sure that we have a clinic that's set up to meet their needs. So as you can see here, there's a photo that was drawn by an adolescent. This comes from the University of Michigan's Adolescent Health Initiative. They have a teen advisory council, a group that they call TAC, who makes lots of different videos that are teen friendly. And they're all videos that are made to inform adolescent providers. So this is in one of their videos, and I took this picture from that just so we can highlight some of the components that make a clinic really adolescent friendly. So the first one is access. So students want to be able to go to the clinic and know that there are hours set out for them to be seen. The second thing is that they want flexible scheduling. And so as you know, things come up really quickly. They want to be able to come to the clinic the same day, so same day appointments. They want the clinic to be flexible. So if they're late, you know, they want you to be understanding, non-judgmental, and be a little bit flexible with that. They do want the services to be low cost, or ideally they want the services to be free. Next, they want the staff to be adolescent friendly. And this is really, really important, and I'll talk more about this later. They want to know that the clinic is LGBTQ affirming and a safe zone. They want to have services that are comprehensive, meaning they want it to be kind of like a one-stop shop. They want to be able to go to one place for medical services, you know, reproductive health, mental health services. So it's ideal if you can have lots of different providers providing that care all in one place. They also want to have continuity of care. So as you know, they're sharing things that are really private, really personal. a lot of the time these things are really embarrassing, and so they don't want to have to come in and see multiple providers and share those things multiple times. So if they could see the same provider and build that rapport, that would be ideal. They also, of course, want the clinic to be comfortable, and they want to have age-appropriate reading. So in the video, if you want to go on to the University of Michigan Adolescent site, you know, they talk about having magazines like 17 and E-Gaming and J14 and all of these other teen magazines. They do want free Wi-Fi. As you know, it's the age of technology and internet use and maybe overuse, but they identified having free Wi-Fi as something that was important to them. And then last but not least, they want to know that there is some confidentiality policy, and ideally this would be posted somewhere in the waiting room so that they know that their confidentiality is guaranteed. So to move on, I just want to talk a little bit about what we do at my clinic. So I work at the UNM Atrisco Heritage Clinic, which is it's a family clinic, it's a community clinic, but it's a really unique clinic because it's kind of a hybrid of a school-based health center in a community clinic, and it's located on Atrisco High School's campus. And I feel like, you know, we try to be pretty teen-friendly at our clinic. We do have pretty good access. It could be better, but we do have hours just for teens at the high school from 7 a.m. to 9 a.m. Monday through Friday. So that allows them to have kind of a private space where they're not going to see members from the community or their auntie or someone like that. So they do appreciate that. You know, if they do need to come in at a later time, say they can't miss a class in the morning, they can be seen in the afternoon, but they know that community members will be in the clinic, and we do offer same-day appointments. In terms of our services, so confidential services are free for mental health and reproductive health, and we really try to stress that. In terms of the other medical services, we do accept Medicaid, Blue Cross Blue Shield, but unfortunately at our clinic, because we're a UNM clinic, we're not accepting Presbyterian or United, but we're working on that right now. We do have a pretty friendly staff that's pretty welcoming, and I'll talk more about that in the next slide. We also do have posters up in our clinic, you know, the rainbow posters that do indicate that we're a safe zone and we are LGBTQ affirming. Our clinic is pretty comprehensive. We have a whole variety of providers. You know, we have 4 MDs, 3 PAs, a nurse practitioner. We have 2 psychologists and a social worker that are there part-time. So we really try to offer comprehensive care. In terms of continuity, we really try to make sure that when the teens come in, they're scheduled with the same provider who saw them on the last visit, and that really comes down to our staff looking into the chart and making sure that they set up that teen with the same provider. There are some things that we could do better, and we're kind of working on these things, but of course it comes down to funding. We could have, you know, more appropriate adolescent reading materials in our waiting room. We don't have free Wi-Fi, and I think that in general we could do better in terms of advertising our clinic. So I just kind of wanted to see what other people out there are doing and what they think is going well in their clinic, and maybe things they're doing that make their clinic teen friendly that weren't mentioned. Please chime in.
To remember too, for those of you who don't have access over the speakers, you can also type in your question and Kevin can pick it up for Melanie as well.
And we do have a chat in Facebook, Snapchat, or other social media outlets. Also, if you need to unmute, that is on your bottom left of your Zoom screen.
So maybe the question is how you would use those. Yes. I'm just wondering, Gustavo, you wrote using Facebook, Snapchat, or other social media outlets, and I'm assuming you mean to advertise the clinic services and get some buzz about what's happening in the clinic. Could you Are you doing that in your clinic? Would you mind sharing with us a little bit about how that works?
We're trying to set it up. We're going through our IT in order to get the permission to set up a Facebook, our hours for the office, send me healthy reminders, some information that they can email out to, and as well as our outreach to post on Snapchat or on Instagram, so that way they can follow us and have more for, I guess, more likes to get, the more people are like, hey, cool, you can pick up the clinic.
Thanks, Gustavo. We had a little trouble hearing you, but I think we picked up some of that. So you're saying it's a way to kind of let kids know about the hours of the clinic, what kinds of services are available, kind of to provide some outreach to them. Is anyone else using social media? And would you mind telling us where you're from, Gustavo, so we know? I think those are
school-based health centers in Las Cruces.
In Las Cruces, okay. I think those are just awesome ideas because obviously kids use those kind of things a lot to communicate. Oh, Chaparral and Anthony. Okay, great. Nice to see you. And for some of us in larger institutions, it's kind of difficult to get permission to use those social media outlets. I mean, I think we could, and it's kind of a good challenge for us to think about how we might get that through at UNM. So thank you.
One of the things that I've seen in some school-based health centers is kind of comfortable and colorful furniture. So I've seen bean bags, I've seen kind of dorm lighting, painted walls that are just, fun. And also we see a lot of clinics that have youth artwork. So the students from the school are providing some of the artwork to hang in the school. So I think that's a really nice way to help create an environment that feels user-friendly.
And I think one of the challenges for a lot of us who work in pediatrics is that we're seeing adolescents in a clinic that is completely designed for little kids. Small chairs, little toys, lots of kids running around, and it's really not conducive. It's not the kind of place that adolescents really want to go or be seen, and so that can be a real challenge. The other challenge is seeing adolescents in a community clinic where they may be coming for kind of a sensitive personal thing. Their parents may not know about it, and there may be community members there who know their family, or they might feel that there would be people like that. In many of the smaller communities that I've visited, one of the challenges is actually that, oh, my mother's second cousin is the secretary at the clinic, and what's she going to say if I come? And those are real challenges in smaller communities for adolescents who are seeking confidential services, which is why the school is such a good place to provide these kind of services for teens.
I agree. And as we move forward, I really want to talk about how it's a team effort, because if you want to have a successful adolescent clinic, it really does take everybody in the clinic working together. At my clinic at Atrisco, we have a pretty diverse, well-trained staff. So everyone who works there is very interested in providing care for adolescents. And I think we all really look forward to the mornings because it's really fun and energizing. And we like seeing the teens in our clinic. But in terms of confidentiality and kind of getting the ball rolling, it really starts at the front desk. So even when teens are coming in to make their appointment, that front desk person has to know the rules of the clinic, know about what services are confidential, kind of indicate that in the chart as a confidential service. They really set the stage. In terms of when the adolescent patient actually comes in for their visit, at my clinic, they're really they're really on top of handing out the school-based health questionnaire, which Jane will talk about later. They're pretty proactive in terms of getting pregnancy tests done if someone's coming in for contraception, getting them the forms that they need if they're there for a sports physical, making sure that those are all filled out. the advantage that we have most of the time, probably 90% of the time at my clinic, is that parents are not present. And so it makes it easier for us in terms of getting really honest responses in the student health questionnaire, because we don't have to worry about parents kind of peering over and looking at the form. Also, it's really helpful that our medical assistants give those forms out ahead of time. And so by the time I see a teen in the clinic room, the student health questionnaire is already filled out, and I already know what areas I should focus on, and we'll talk more about that later. So I think having the patient fill out the student health questionnaire prior to you entering the room really allows you to have honest information. So next we'll move into screening for adolescents, and the HEADS approach is really an interview approach. It's a psychosocial interview that you're using for adolescent patients. And this really kind of replaces the review of systems or the social history that you would be obtaining from an adult patient. So for teens, we say that this is at least as important as the physical exam, because you really want to know about what they're doing. Adolescence is a time of social exploration, growth, and development, but with that comes some threats to their health overall. So things that we'll be addressing more with this mnemonic are: how are things going at home? What's their education like? Are they working? What are their eating habits like? Are they involved in activities? You know, what is their experience with drugs, domestic violence? How are things going in terms of their sexuality? Are they sexually active? Is depression starting to emerge? How's it going with their mood? Do they feel safe? And actually, something that has been proposed recently is that we take a more positive approach to this screening. And so if you read about the HEADS questionnaire, they propose this She-HEADS model, where you're actually asking about strengths and spirituality even before you ask about how things are at home. And I'll talk a little bit more about that at the end. So in terms of asking about how things are at home, you know, with all of these different areas, I want to mention why you should ask, because I feel like it's really important to know about how things are going with our population. So in our community, you know, in New Mexico, 25% of youth in New Mexico have multiple significant adverse childhood events and childhood trauma, or what we know as ACEs. And so it's really important to know what their home life is like. We also know that in New Mexico, 80% of New Mexico children are born Medicaid eligible, and we know that with poverty, you know, there comes a lot of other things that we need to be worried about. So things that you should ask, you should focus on really open-ended questions. So you want to ask something like, where do you live and who lives there with you? You really want to steer clear of asking, you know, do you get along with your parents at home? Because that's not really a helpful question. So you want it to be more open-ended and kind of draw out what's going on at home. What are your relationships like at home? Who can you talk to about your stress? And we also know that if they can identify a caring adult, that's a protective factor, and that's really important. So after we ask about things at home, we start kind of getting into maybe questions that might be a little bit more threatening. Although I guess sometimes you identify things that might be kind of risky even when you ask about, you know, general things in terms of how things are at home. So next we're going to move on to education and employment. Why you should ask? Well, sometimes, you know, kids are sent into clinic because they're misbehaving, or they're a bad kid, or they have, you know, issues with substance abuse or something like that. But we kind of label bad behavior as just a bad kid, and sometimes there might be another issue going on that we need to figure out or that we need to address. So bad behavior might actually indicate that, you know, the patient has a learning disability. Do they have ADD that's never been diagnosed? Do they have a mental health condition that's never been diagnosed? Is there some kind of acute stressor that you could really help out with? So if you can identify what this bad behavior is, you might be able to offer some resources. So types of questions that you should ask: tell me about school. What is school like? What do you like and dislike about school? Do you feel safe at school? Do you have goals? What do you want to be when you grow up? You know, how are you doing in school? Have there been any recent changes? Have you moved schools? You know, have there been setbacks? Are you supposed to be a junior and you're a freshman? Well, what's gone on there? Also, a lot of kids that I see are working many hours. So you want to ask about where they work, you know, how many hours are they working, because this really does set them up for additional challenges. And lots of students that I see are actually working, you know, not to buy fancy things like the newest shoes or, you know, video games, are actually working to pay bills and help their parents. And so that's an additional stressor. We also know that, you know, if we see teens who are working more than 20 hours a week, that's associated with really poor outcomes, more stress, substance use, things like that. So our next E is eating. So why you should ask? Well, we know that in New Mexico, 26% of teens are overweight or obese. We also know that adolescence is a period where we start to see eating disorders emerge. So from the New Mexico data from our student surveys in 2013, we know that 6% of New Mexico teens reported that they had vomited or used laxatives in the last month, and 50% reported that they were trying to lose weight. So they may not be, you know, trying to lose weight in the most appropriate way, and so you should really ask about those things. Ways that you can ask about those things might be, how do you feel about your body? Does your shape cause you any stress? Are you trying to lose or gain weight? Have there been any recent changes in your weight? Have you dieted in the last year? And tell me more about that. And our A in the HEADS assessment is activities. So why you should ask, we know that teens who are more involved with activities in school are less likely to be involved in risky behavior. So it's really tied to their sense of well-being and sense of accomplishment. And so that is directly related to their mental health. Types of questions that you should ask, you know, what do you and your friends do for fun? What do you do in your free time? Where do you spend your time? Are you involved in hobbies or clubs or, you know, some kind of spiritual organization? Are you involved in sports? These kinds of things can also be related to stress at the same time. So it's good to figure out those things. And then another question that you should ask that's pretty relevant today is you should ask about internet use. Do they have a computer in their bedroom? How are they using the internet? How many hours are they spending in front of their screen? I think studies show that teens are using social media about 7 hours per day in different forms, and so that's a lot. Our next section is drug use. So why should you ask? We know that in New Mexico we have a big problem with drug use, especially IV drug use, and unfortunately these issues start really early. In New Mexico we have higher than average use of drugs in terms of our adolescent population, and this is for cocaine, IV drug use, marijuana use, and heroin use. I think our heroin use for teens is twice that of the national average, so risky behavior starting really, really early. Types of questions that you should ask, you know, do you have, what drugs have you seen people using at school? That's a really kind of non-judgmental way to ask that question. Do you have any friends or family members who are using drugs or alcohol? How are they using them? One current issue right now is the use of e-cigarettes. So you may ask just about cigarettes and they say, no, I'm not using cigarettes, but actually I think according to the most recent data from New Mexico, 30% of New Mexico teens have used an e-cigarette in the last 30 days, so it's pretty high. You also want to ask about other substances like energy drinks, steroids, or other medications that they may be using that are not prescribed to them. So our first S is for sexuality, and I think everybody gets kind of nervous when they have to ask a sexual history because it's kind of awkward, but we should try to start moving away from that and thinking of sexual health as just health, as you can see from the little picture in the corner. So why you should ask? Well, 40% of New Mexico teens have had sex, and only about 50% of those teens are using condoms. Less than 5% of those teens are using long-acting reversible contraceptive methods, which we know are the most effective. And about 25% report that they're not using any form of contraception. And these are New Mexico teens. So types of questions you should ask, have you ever been in a romantic relationship? Tell me more about the people you've dated. Have your relationships been sexual? Tell me more about that. Who are you attracted to? And this really gets at, are you interested in men, women, both? Are you not really sure? And you might want to preface these questions with saying something like, I have to ask you some questions that might be embarrassing, but it's really just to help me get more information about you so that I can help you and offer you the most appropriate advice. And here in the corner, you can see a picture of the gender unicorn that was created by the Transgender Resource Center. And so this is basically a spectrum for the teen to identify kind of how they fit into the spectrum in terms of gender identity, gender expression, who they're attracted to physically and emotionally. And then our next S is suicidality or sadness, which gets at depression. So why should you ask? We know that New Mexico youth 10 to 19 have a higher rate of suicide compared to national averages, so about 9.8 per 100,000 versus 4.8, so that's pretty high. There are different types of questions that you should ask. So do you feel stressed or anxious more than usual? Are you sad or down more than usual? Try and figure out if they're having trouble sleeping, because that might actually be an indication that they're depressed. Have you ever tried hurting yourself or someone else? Another thing that I wanted to mention is that often adolescents exhibit depression in different ways. So they might say that they're really bored, or they're irritable, or they're anxious, or they're moody, or parents might even say that they're moody, and that might actually indicate that they're depressed or have some other kind of mental health issue going on. And also one thing that I wanted to mention for teens is that they are more likely to say that they're stressed or anxious than they're sad or depressed. So you really want to tease that out. Our next S is safety. So we know that we see teens texting while they're driving. 40% of teens are texting while they're driving. In New Mexico, 30% of teens reported being in a physical fight in the last year. 11% reported a history of physical or sexual violence. So types of questions that you want to ask here are, have you ever been seriously injured? How you want to ask about seatbelt use. You want to ask about bullying. Have they been a victim of bullying? Something that is more common right now is meeting up online. So you want to ask about meeting up with people online. Texting while driving, as I already mentioned, and then we'll get at I think Jane will talk a little bit more about the craft questions, which get at substance use. Are you riding in a car with someone while they're drunk or high? And then you want to ask about the home situation, so violence, sexual violence, things like that.
All right, so we're going to switch over to, so the HEADS assessment is really a great tool if you don't have another tool that you can use in the clinic. So in the absence of a more structured screening tool, either on paper or given via computer, the HEADS is really a great acronym that kind of reminds you and helps guide you through doing an assessment of your teen. But I want to talk a little bit about using either an electronic or a paper tool. What we do know from the research is that just doing a verbal risk assessment with an adolescent is helpful, but they're much less likely to be candid in their responses than if you ask them to fill out a risk assessment on paper. The paper risk assessment is better than the verbal encounter with the provider, but not as good as the electronic. So the electronic assessment is the one where you're most likely to get the highest level of fidelity with what the patient is actually experiencing. So they're the most likely to be candid and honest in their answers. There are some other issues for those of us who are using, and maybe we could use the chat box. Could you guys let us know how many of you are using a structured tool in your patient encounters, and what is it, just so we could get a sense. I know here at the UNM School-Based Health Center program, and in many of the school-based health centers in New Mexico, people are using the ESHQ, which was renamed this year to Just Health. And some of us have that electronically and others on paper. So let us know what your clinic is using if you're using a structured tool to do your assessment. Our standard, and I think the standard that was set by the School-Based Health Alliance, is to do an annual risk assessment for all of our patients. And we do that basically no matter what door they enter. So if they come in with a behavioral health referral, the behavioral health person will do the assessment. If they come in for an immunization and it's just a quick visit, we'll bring them back and do their annual. So we really try to hit every single kid who comes in the door to the school-based health center with that assessment. Where it's where we've had, you know, kind of, I think some reinforcement for that is often in the beginning of the school year, we'll have an onslaught of young student athletes who give the appearance of being, you know, on top of everything, and they're doing well in school and they're involved in sports. And so we make the assumption that they don't have a lot of risk factors. And in fact, when we ask them to fill out our form, we're really surprised. And I'm reminded of a patient that we saw at our clinic last year. I think Jane saw him, who was a sports player on one of the teams, who was filling out his risk assessment and started crying and could not stop. You know, here was a kid who appeared to be completely fine, you know, doing well in school, a prominent athlete, who obviously had so much emotional stuff going on that when we asked him the questions and he started to respond, he just kind of fell apart in our clinic. So let's see, some of our responses here. So April from Ruidoso, let's go back. So you're using the ESHQ on the iPad. Great. So we'll have some opportunity to talk about that. Adriana Apodaca from La Clinica is working with Apex using the ESHQ, the PHQ, and the Chispa on the iPads, and we'll talk about those things. John from Mora, the SHQ on paper, John, or paper? Yeah, paper in Mora. Sandra Burney. Oh, hi, Sandra, from the Teen Life Center in Shiprock, right? They're using a paper adolescent health screening survey. So that's probably the SHQ at our school-based health centers. We use a variety of screenings, some paper, some electronic. And she says that the disclosure of high-risk behaviors seems higher on the electronic forms. At one school, they screen all the students at the school, and others just when they come to the clinic. So thank you, Sandra, and good to see you're here with us today. So I'm not going to go over the whole SHQ, but I just want to show you, for those of you who aren't using it, and maybe we can start developing some dialogue for those who are as well. Some of the tool that we're using has embedded in it some validated subscales, which are a standalone screening tools. And the first of those is called the PHQ-2, and probably a number of you are familiar with that. So the PHQ-2 is just 2 questions that screen for depression. And the first is so the question is, have you been, over the last 2 weeks, so it's kind of a short time window, how often have you been bothered by any of the following problems? And then little interest or pleasure in doing things is the first, and the second is feeling down, depressed, irritable, or hopeless. And the way this is scored has to do with, so obviously a not at all would be a 0. So if they, so what you're looking for is a total point score. Several days is a 1, more than several days is, more than half the days is a 2, and nearly every day is a 3. So a patient that scores a 0, obviously we're not too worried about. And then a score of 6, the probability of a major depressive disorder in those patients is between 78 and 92%. So those are patients you're really worried about. In many of our clinics and on our iPads, we have the ability, if they have a high PHQ-2 score, we can then have them fill out the PHQ-9. I want to talk about that just a little bit. There is an adolescent, ooh, we are moving here. There is an adolescent version of the PHQ-9 if you haven't seen it, and it's called the GLAD PC. And
it's not included as a handout, but if you actually Google it, you can find it, and we
online.
can, if you need it, please email us. We'll send it to you.
Okay, let's keep going. Let's go down to the CRAFT, which is our other. So Kevin, if you could keep going down. Yes, here we go. So the next embedded screening tool is called the CRAFT, and I'm sure many of you are familiar with it. It's really, I think, probably the most well-known validated screening tool for adolescent substance use. A score of 2 or above is a positive CRAFT, and for those of you who are in the CHISPA project and have been trained on the use of SBIRT, I'm sure will be familiar with this, but for those of you to whom this is new, if you look at the questions, so a positive question on more than one of these would be a positive screen. And if you have a positive screen, you would then talk to the patient in a little bit more detail about their substance use, provide them some brief counseling, and depending on the extent of their use, and we will talk about this in much more detail in the future, but depending on the extent of their use, you would refer them for further treatment if such treatment were available. Now, later on in this series, Jeannie, my colleague over here, who has a ton of experience and is she's just terrific at working with kids who are using substances and teaching all of us how best to approach this pretty tricky topic. So the embedded CRAFT is another piece of what you can put into a structured questionnaire that makes it so much more powerful and effective. Okay, so what's our, then I just want to talk briefly, one of the things I really like about our student health questionnaire is this alert report. So rather than having to look through every single question, we are able to look at a consolidated report. I realize this is going to be a little tough for those of you who haven't seen this before, but I'll go through some of it briefly. It gives the name, date of birth, age, grade, and then gender. So it allows kids to self-identify their gender identity and their sexual orientation. I'm old enough that I started practicing adolescent medicine at a time when really you know, you had male, female, and you assumed that nobody was gay, lesbian, bisexual, or transgender because they never talked to you about it. But boy, times have changed. And I am personally really struck by the number of kids I see who have, what do we call it,
Gender non-conforming.
well, but also that it's not non-binary, or they're very gender fluid, and kids that I'm surprised by, and the extent to which they have really thought about these things, and they're an important part of their lives and self-identity. Also, as a provider, it makes life considerably more tricky when you're dealing with reproductive health issues, because their gender self-identity and sexual orientation don't necessarily provide a very clear guide about what they need in terms of their reproductive health care. So it makes that more interesting. Also, I think super important for teens is their home life. Who do you live with? And is there a person you can talk to? And one of our questions on here, they can also put an online friend. And it's amazing how many kids you see who have an online friend that fits into that category of people that they feel they can really talk to about their problems and issues. So I think at one point in time we were all terribly worried about that, and now I think we understand that actually that is a thing. It's not necessarily a creepy thing. It may be a fine thing, and be careful about the assumptions that you make. I think if a kid says that their only friend is an online friend, that's a different story. But so those kinds of questions are, I think, really important. Are there problems at home? Obviously, the health behaviors. These are the domains that this particular screen is divided into. Safety and injuries, feelings and well-being. Obviously, anything in red, those are very high risk, but yellow also says, hey, this is going on, you need to pay attention. So as a provider, you can scan this pretty quickly to see the areas that you need to address. I think once you have this information, it's really important to go check it out. I generally start by introducing myself to my patients and saying, you know, we asked you a lot of nosy questions when you came in here, and if it's okay with you, I'm going to go over some of those with you and ask you some additional questions. If you don't feel comfortable answering those with me, that's fine. You don't have to. Just say that. I did a little personal experiment once years ago that really clued me into how sensitive this tool is. And I was doing my resident teaching, and I had a group of, I don't know, first, second, third year pediatric residents. And I thought, oh, I'm going to have them take the SHQ. And I handed it out. Oh my goodness, the mood in the room just fell through the floor. You know, people were just, you know, and I realized that this group, pediatric residents are a very vulnerable group of people. They have a lot of these, you know, many of them are depressed and anxious and substance using. And I realized I had used this tool in this very light way, and actually in a very irresponsible way, because I wasn't the provider for these residents, and there was no real follow-up, and they took it seriously. And so I think when we talk to our patients, we need to acknowledge that they have answered a lot of difficult questions, and they may or may not feel like talking to us about them. And as we learn more about trauma-informed care, at this first encounter with the patient who may be reporting to you that they have been sexually or physically abused, we want to be really careful about uncovering that in a 20-minute encounter with a new provider and then sending that patient back to class. So I will often, on the first visit, acknowledge that, but not necessarily go into any depth about it until I know the patient better and they trust me more. So again, these are things to think about. This is a potent tool. It gives us a lot of information in a short amount of time, but often these are kids who don't know you yet, don't necessarily trust you yet, and we want to be very respectful of the fact that they have shared so much with us, and we want to treat it very carefully so that we can begin to develop our relationship with that patient.
I agree. I think one of the things that I really liked about Dr. Baca is saying that they're looking at a strength-based approach as well. And it's because of that if we're able to balance the conversation and develop a rapport with adolescents where they're able to tell us a little bit about what's going right, they're going to be much more likely than when it comes down to having conversations about what's going wrong, either at home with their mental health or even physical health. They're going to be much more likely. So I would hope that we look at this. This is an opportunity. It's a huge opportunity into the life, understanding the life of an adolescent. And one of the things I'm thinking is maybe for my motivational interviewing talk, we could talk about how to intertwine some more strength-based approaches and in working with these tools, so it doesn't feel so one-sided and has more of an am I feel. Yeah, these are great tools.
Okay, so
Do we have a resources slide?
yeah, we do.
So everyone, we're thrilled to have everyone start today with the Adolescent Health Initiative. I'm hoping that you found this as interesting as I did. I think really, again, this just shows the level of information that we're going to be able to provide for you this semester, this fall of 2016. And as Jane mentioned, we're going to be focusing more on the medical side issues for this semester. And behavioral health, of course, is going to come into play, but we're also going to do a heavy focus of it next semester as well. Just to let you guys know, there's a slide that will give you guys some resources so you can follow up on any pieces that you would like some more information on. And because we've gone over to Zoom, another thing that we're interested in is to see how your telehealth experience went today. So we're going to be sending a very short, brief link that Kevin's going to send to everyone. So just if you could just take a few seconds after we're done today to just let us know how did it go on Zoom and how did today's talk overall meet your expectations, and then that way we can make sure that we can tailor programs to meet your needs. So thank you all for being here today, and thank you all for sharing your wonderful faces on camera, and we will see you guys next Wednesday, same time, same place.
I think there's a couple of questions, and we'll hang on
Okay,
yeah.
Thank you.
Go ahead.
John Taranjo and Kedrick Valdez from School-Based Health Center here in Mora. And I want to make